Are you having hip pain? Is it just going to go away on its own, or is it more serious and maybe you need to be seen by a doctor? It can be really hard to know. So if you're worried about your hip pain and know that you want to find out what type of hip pain it is, whether it'll go away on its own, which ones might need medical attention, you're in the right place. We're going to talk about it in this video. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I hope you feel, look, and perform your best regardless of age or injury. Some hip injuries are serious. Others might not be a big deal and might get better on their own. And how can you know the difference? Well, one way to tell would be based on where you feel the pain. Pain from the hip joint, from the ball and socket, is typically felt in the groin or front of your upper thigh. Pain here can be a sign of hip arthritis, a femoral neck stress fracture, labral tear, maybe a hip flexor strain or tear. Pain felt on the outside of the hip is very often a type of bursitis called trochanteric bursitis, or it can be a tendinopathy of the small muscles that attach to the bony prominence on the outside of your hip. Pain in the buttock usually stems from your lumbar spine or your lower back, possibly a herniated disc or sciatica. Now, that might be an oversimplification, but that rule of thumb generally holds up. So if the pain is felt in your groin, the conditions that cause groin pain, arthritis, labral tear, stress fracture, hip flexor, might not go away on their own, and you might consider seeing an orthopedic surgeon. The same applies to buttock pain, likely coming from a herniated disc or some other problem in your back or sciatic nerve. On the other hand, pain on the outside of the hip joint often does resolve on its own with simple strategies like anti-inflammatory medications and stretching. Also, if you have pain when you bear weight on that leg or pain that causes you to limp, it could be a sign that you have a problem that may not get better on its own. Seeing a doctor sooner rather than later might be a good idea. Along the same lines, pain that persists despite a period of rest could indicate a more serious problem. If you have hip pain, maybe you can try ice and heat and anti-inflammatory medications, modify your activities, maybe rest for a few days to see if the symptoms go away on their own. But if you have some of those signs and symptoms that they won't, or if the pain's getting worse, or if the pain's not getting better, seeing a physical therapist, seeing your doctor, seeing an orthopedic surgeon can be a good idea. I'd love to hear your experience with your hip injury. Leave those in the comments below. I'd love to read those. Just understand, though, I can't respond and offer you medical advice. But I do try to answer these questions in future videos. Also, make sure to subscribe to my channel, click the bell to be notified when I release a new video and when I start another live stream, including my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.